All right, time now for a medical checkup here at Prime News tonight. You know, an estimated 100 million Americans suffer from heartburn each day, and many people either ignore the problem or pop a couple of pills, deal with the pain. But heartburn can lead to more serious medical problems, and now it's even being linked to cancer. Dr. Dan Smith from Emory University is here to help us kind of get through this, talk about some of the hidden dangers. Thanks for being with us. And first off, really basic, acid reflux, heartburn, are they one and the same?
I think for practical reasons, you can consider them one and the same. Heartburn is really that sensation of acid coming into your esophagus causing that burning feeling.
Okay, so more the symptom, the acid reflux, it's there regardless of the symptom. And the second question, I'm sure a lot of people out there asking, okay, I have mild heartburn every now and then. How do I know it's not just that and maybe it's something more serious?
Well, you're absolutely right. All of us get some heartburn and indigestion from time to time. If you have heartburn on a daily basis, or it's severe heartburn, wakes you up in the middle of the night, over-the-counter medicines don't control it, you may have a more serious problem that needs prescription medicine or a physician visit.
And you're kind of hitting on that right there. The occasional heartburn, go ahead and do the Tums or whatever you like. If it's daily, go over-the-counter. I mean, go with the prescription. And the next thing is, and it's your field of expertise, the surgery. When does someone need surgery for acid reflux?
If the medicines aren't holding or controlling the symptoms, surgery may have a role in creating a better valve or barrier between the stomach and the esophagus, which is really what the problem with reflux is an incompetent valve between the stomach and esophagus.
Okay, this is the crutch of an argument of theories out there. One theory states basically that the acid-suppressing drugs keep the acid down, but now bile's coming up. And that could be causing the cancer because it's more damaging in the esophagus. What are your thoughts on that?
There's no question that esophageal cancer is on the rise, and at the same time the use of these antacid medicines is also on the rise. So in theory, there may be something there, but we spent 10 years trying to find an absolute link between the use of these medicines and esophageal cancer, and we haven't found it definitively.
Esophageal cancer, you just said it, it is on the rise. Is diet the problem? Is that the reason? Is that where we can nip this possibly?
Possibly, but there are all sorts of factors here. Diet is one, but the other thing that we have to pay attention to is obesity. And unquestionably, esophageal cancer is linked to obesity, and we all know what's happening today in America with the epidemic of obesity.
How about real quick, some specific tips? I mean, is it the larger portion sizes? Are things like that some simple things we can do to kind of help reduce our risk of getting acid reflux?
Well, I think avoid eating large meals late in the day. Certainly don't eat a large meal right before going to bed or lying down. If you are having frequent reflux, you can prop the head of the bed up at night to help minimize the effect of gravity, making the reflux worse. But if your heartburn is on a daily basis, you should probably seek advice from a physician about how best to treat it.
Okay, again, startling statistics here that esophageal cancer is on the rise, so thanks for lending some insights on it.
Thanks for having me.
Talk to you soon. Thanks.